High-sensitivity C-reactive protein, hs-CRP. In the world of medical science, there are numerous tests and markers that help doctors assess our health. One such marker, high-sensitivity C-reactive protein, hs-CRP, plays a crucial role in detecting inflammation in our bodies. What are high-sensitivity C-reactive protein, hs-CRP, and its association with inflammation? High-sensitivity C-reactive protein, or hs-CRP for short, is a special protein produced by the liver in response to inflammation in the body. Inflammation is our body's natural response to injuries, infections, or diseases. It's a sign that our immune system is at work, fighting off potential threats. However, sometimes inflammation can become chronic, and that's when it can lead to health problems. hs-CRP is referred to as high sensitivity because it can detect even small amounts of inflammation that may not be noticeable through typical tests. This makes it a valuable marker for assessing the risk of various health conditions. Why high-sensitivity C-reactive protein, hs-CRP? Now, you might be wondering, why is hs-CRP so important? Well, it can provide valuable insights into your overall health. Here are a few reasons why hs-CRP testing matters. Detecting hidden inflammation. hs-CRP can reveal inflammation in your body that might not present any symptoms. Identifying inflammation early can help prevent or manage various health issues. Risk assessment. Elevated hs-CRP levels are associated with an increased risk of heart disease, stroke, and other cardiovascular problems. It can serve as a warning sign for these conditions. Monitoring chronic conditions. For individuals with chronic diseases like rheumatoid arthritis or inflammatory bowel disease, hs-CRP can help monitor disease activity and treatment effectiveness. Customized treatment. Doctors can use hs-CRP levels to tailor treatment plans. For example, it can help determine if a person with heart disease needs more aggressive treatment to reduce inflammation. Common high-sensitivity C-reactive protein, hs-CRP, values. When you get your hs-CRP test results, you'll typically see them measured in milligrams per liter, mg/L. Here's what different levels generally indicate. Low risk, less than 1 mg/L. This is considered a low-risk range, indicating a lower likelihood of inflammation-related health issues. Average risk, 1 to 3 mg/L. Falling within this range suggests an average risk of inflammation-related conditions. High risk, above 3 mg/L. If your hs-CRP level is higher than 3 mg/L, it may signal an increased risk of heart disease or other inflammatory conditions. It's important to note that hs-CRP levels can vary from person to person, and a single test result should be considered in the context of your overall health and medical history. Interpreting high-sensitivity C-reactive protein, hs-CRP, results. Understanding your hs-CRP results is essential for making informed decisions about your health. If your results fall within the low-risk range, it's generally a positive sign. However, if your levels are in the average or high-risk range, it doesn't necessarily mean you have a specific condition. It's a signal to your healthcare provider to investigate further and consider other factors. For example, if you have elevated hs-CRP and other risk factors for heart disease, like high cholesterol or high blood pressure, your doctor may recommend lifestyle changes, medications, or additional tests to assess your cardiovascular health. How is the test conducted? The hs-CRP test is a simple blood test, similar to many other routine blood tests. Here's what you can expect. Preparation. Usually, there's no special preparation required. You can eat and drink as usual before the test. Blood draw. A healthcare professional will draw a small amount of blood from a vein in your arm. You may feel a brief pinch or sting during the procedure. Laboratory analysis. The blood sample is then sent to a laboratory, where technicians measure the hs-CRP level. Results. Your doctor will receive the results and discuss them with you during a follow-up appointment. The whole process is relatively quick and minimally invasive. For whom is this test and what diseases is it for? The hs-CRP test can be beneficial for various groups of people. Individuals with cardiovascular risk factors. If you have risk factors for heart disease, like smoking, obesity, family history, your doctor may recommend this test to assess your heart health. Patients with inflammatory conditions. Individuals with chronic inflammatory conditions such as rheumatoid arthritis, lupus, or inflammatory bowel disease may undergo hs-CRP testing to monitor disease activity and treatment effectiveness. Post-heart attack or stroke. After a heart attack or stroke, monitoring hs-CRP levels can help doctors assess the risk of recurrence and guide treatment decisions. General health check. Some healthcare providers include hs-CRP as part of routine health screenings, especially for middle-aged and older adults. In terms of diseases, hs-CRP is particularly valuable for assessing the risk of heart disease. Elevated hs-CRP levels are linked to an increased risk of heart attacks and coronary artery disease. Stroke. It can also be a predictor of stroke risk. Inflammatory disorders. Inflammatory conditions like rheumatoid arthritis and lupus can lead to elevated hs-CRP levels. Infections. Acute infections can temporarily raise hs-CRP levels, but they should return to normal once the infection is treated. Conclusion. High-sensitivity C-reactive protein, hs-CRP, is a powerful tool in the world of healthcare. It helps detect hidden inflammation, assess cardiovascular risk, and monitor chronic conditions. While the test is relatively simple, its implications for your health can be profound. If your doctor recommends an hs-CRP test, don't hesitate. It's a valuable step in taking control of your well-being and ensuring a healthier future. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.